And good afternoon. It is Friday, and that means it's time for our Lunch and Learn. Now, today, I was just flabbergasted when I read this report, and so I'm going to share this with you. Now, when I was a little girl, for as long as I can remember, my mother told me you brush your teeth twice a day. For all of my life, I have brushed my teeth at least twice a day, if not more often, depending on what I get into during the day. I actually have a toothbrush in my office. So if I feel the need to do a midday cleanse, I can do that. So it's really, really important to brush your teeth, but I had no idea that your life expectancy was dependent on your dental care. Now, we know about 85% of sickness and disease starts in the mouth, so we know that dental care is very, very important, but I had no idea it was this important and that it referred or related to cardiovascular disease and some cancers. And so you're going to want to pay attention to this. And some of these statistics are a little bit gross. If you're someone who brushes your teeth 2 to 3 times a day, then you're in my circle. But there are some people that never brush their teeth. They did this by survey, and I can't imagine somebody just not brushing their teeth. I don't know how you live with yourself. I'm just saying that. No judgment there. But when my teeth are feeling that little bit of ickiness, I get up and go brush my teeth. So it doesn't take that long. It takes about 2 minutes to brush your teeth, and it is extremely important to your health, particularly, as I said, cardiovascular disease and cancer. So a recent study from Japan showed that brushing your teeth before going to bed at night is particularly important, and that the nightly brushing of the teeth may lower your cardiovascular risk. Another study found that brushing your teeth more than once a day could reduce your risk of cardiovascular disease by 9%. A different study that was published in Scientific Reports, which is a sister journal to Nature, shows the relationship between toothbrushing and cardiovascular disease incident rates. So the study recruited 1,675 patients aged 20 and older who were already in the hospital for surgery, examination, or drug treatment. So they were already not doing well, whatever that meant. They were divided into 4 groups according to when and how frequently they brushed their teeth. So the first group brushed morning and the night. I would fit in that. The second group brushed only in the morning. The third group brushed only at night. And the fourth group never brushed. Now, I'm sorry, I just cannot imagine. I would have to be really sick not to brush my teeth. I think I would have to have some mental issues not to want to brush my teeth. Just throwing that out there. The results were analyzed for the relationship between toothbrushing habits and the incidence of cardiovascular disease. The study found that cardiovascular disease survival rates of patients in the morning and night brushing group and in the night only brushing group were significantly higher than that of the non-brushers. So it doesn't take an Einstein to understand that, right? So one of the takeaways from this study is if you brush your teeth twice a day, you're good. If you brush your teeth at night, you're good. But if you only brush your teeth in the morning, you're not so good. So for all of you out there, whoever you may be, and please don't raise your hand because I do not want to know, if you only brush your teeth in the morning, please consider changing that to brushing only at night if you can only manage to do it once a day. The non-brushers and the proportion of brushing after lunch in these 2 groups was higher than that of any other group. So the night only or the twice a day brushers had a higher resiliency. They were less likely to develop cardiovascular disease than the non-brushers, the brushers in the morning, or the brushers only at lunchtime. So that's really important to understand. The timing of when you brush is important. So nighttime brushing seems to be the most important time. So we want to make sure that you do that. This is a quote from one of the doctors. The findings clearly indicate that only brushing in the morning after waking is inadequate and that brushing at night is good to maintain good health. I'm still going to do twice a day. I don't care. Maybe more depending on what I eat during the day. In addition, the subgroup analysis based on smoking habits found that among patients who smoked, the prognosis of cardiovascular disease in the non-brushing group was worse than all the other groups. Among the non-smoking patients, hospitalization prognosis in the non-brushing group and in the morning-only brushing group was very, very poor, which means that if you're only going to go once a day, do your teeth once a day, it's better for you to do it at night than only just do it in the morning. So they don't know why it's like this, but these are their hypotheses. Tooth loss is the result of periodontal disease or dental cavities caused by an increased amount of oral bacteria. That is likely to contribute to a decline in chewing efficiency and overall health in the body. Oral bacteria causes an imbalance of bacteria in the intestinal tract, leading to a decline in overall bodily health. Now, we've seen other reports that do talk about people with endometriosis has a specific bacteria in their gut. People with colon cancer have a specific bacteria in their gut. And so if we're looking at this and if we're listening to these researchers, they're saying that if you do not brush your teeth or you brush your teeth at the wrong time, then you're allowing bad bacteria to make its way down into the stomach lining, your large intestine, small intestine, that kind of thing. And what that does is contribute to cardiovascular disease and cancers. So we don't want to do that. There was another study that was published in the European Journal of Clinical Investigation, which examined oral hygiene and various diseases among more than 500,000 people aged 30 to 79. The results showed that when compared with people who brush their teeth regularly, people who never or rarely brush their teeth had a 12% higher risk of major vascular disease, an 8% higher risk of stroke, 18% higher risk of cerebral hemorrhage, all right, a 15% increase in myocardial infarction, heart attack, 22% increase in COPD, that is a lung disorder where you can't breathe, 22% higher, and then 9% increase in cancer, 12% increase in COPD, I said that already, 25% increase in liver cirrhosis. So a lot of times we think that liver cirrhosis is happening because we drink too much alcohol. There is a disease called non-alcoholic fatty liver disease, all right? But there's also this fatty liver cirrhosis disease that occurs when you do not brush your teeth twice a day or at the very minimum in the evening. Now, there was little difference between type 2 diabetes and chronic kidney disease. Now, we see diabetes all the time. We see chronic kidney disease all the time. Toothbrushing did not seem to affect that at all. Globally, 41 million people die from various chronic diseases every year, accounting for 74% of all deaths. Studies have found that unhealthy health habits such as smoking, lack of exercise, poor diet, not brushing your teeth, or just doing it rarely are associated with a higher risk of chronic disease. In February, a study on the relationship between toothbrushing and chronic disease involving 18,000 people, averaging about 61 years old, showed that people who brushed their teeth only once a day or who did not brush their teeth at all had a 50.24% increase of suffering a chronic disease, with cardiovascular disease being the highest at 40.2%. So what does that tell us? That tells us that if we have older people in our lives, we need to make sure that they are not neglecting their choppers, all right? We want to make sure that they brush their teeth at least at night, if not morning and night, or even more often than that. So it is a 40.2% increase in cardiovascular disease for older people. I don't want to say elderly people at 61 because I really don't feel that I'm elderly. All right, I am older and I am more mature. I do brush my teeth, as I said, minimum twice a day, sometimes 3 to 4 times a day, depending on what I get into. Other diseases on the list include endocrine diseases, nutritional metabolic diseases at 15.39%, musculoskeletal diseases at 3.79%, digestive system disorders at 2.04%, respiratory system diseases at 1.79%, and gynecological issues at 1.38%. So if you're dealing with, 500,000 people, you take 500,000 and you do 1%. How many is that? That's still a lot. And so we don't want you or people that you love or people that you care for not having the health that they want because they're not brushing their teeth with the regularity that they need to. So periodontal disease is usually caused by improper dental or oral care, and periodontal disease is also linked to autoimmune disease and mental illness. So if you have somebody in your family who's suffering from depression, major depression, all that kind of thing, you might want to think about, ask them about how they're doing on their dental hygiene. Have they been to the dentist? Do they have issues they are not attending to? Are they brushing their teeth at least at night, if not more often? All right. A respective study published in the British Medical Journal Open, which is a sister journal to the British Medical Journal, used UK's primary care data involving more than 15 million people for comprehensive analysis. The results showed that compared with the control group without periodontal disease, people with periodontal disease, such as peritonitis or gingivitis, had an 18% higher risk of cardiovascular disease, a 7% higher risk of cardiometabolic disease. The risk of autoimmune disorders also increased by 33%, while the risk of mental illness increased by 37%. So really, how you go to the doctor and they'll say, oh yeah, well, your symptoms, there's nothing to show for it. It's all in your head. They may not be telling you a lie. It may be in your head, in your mouth. If you're not brushing your teeth, your body is sending you signals. You may not be in a disease process with the doctor, but you may have problems in your mouth that you're not dealing with that's going to cause issues. So please, if you do not brush your teeth at least twice a day, please consider these statistics and see what you can do. So the result of periodontitis is invariable loose tooth loss, and the studies have found that tooth loss is also closely related to dementia. One study of elderly Japanese with varying degrees of tooth loss showed that the group with the fewest teeth, 0 to 10, you've got 33 teeth in your mouth, okay? 0 to 10 had a 71% increase of mild memory impairment compared to those that had at least 22 of their 33 teeth remaining. So this is really important. Dental health is a precursor to mental health, and so we want to make sure that we age well, that we still have our teeth, we still have our cognitive functions and all that kind of stuff. And so it is important to take care of our teeth. The CEO of the Taiwan chapter of the American Academy of Anti-Aging Medicine and the CEO of the Taiwan Hanshi Integrated Functional Medicine Clinic posted on his Facebook page that people often ignore oral health and that chronic inflammation in the body may come from oral health that has been neglected. And so if you are dealing with an autoimmune disease, you want to check and see what's going on with your dental health. If you're dealing with depression, sadness, lack of focus, all those kind of things, it could be just as easy as getting your teeth repaired or whatever's going on with you in that way. Bacterial populations form biofilms, which we call that plaque, on the teeth and the oral gum tissues. And over time, this can destroy oral flora, causing chronic inflammation, immune system imbalance, all right? So when we do mouthwash, when we do all those kind of things that we are quote unquote supposed to do, we are messing up the good bacteria in our mouth. And when we do that, we allow the bad bacteria to proliferate. And when we do that, we get plaque. So think back of when you went to the dentist last. Did you have a lot of plaque? There's some people that need to go to the dentist every quarter instead of twice a year because they have so much plaque on their teeth. They just make a lot of plaque. That's the body's way of protecting the teeth and the gums. So we don't want to say that's a bad thing. However, it's not a good thing because that indicates that your oral health is needing some attention. And so what we want to do is to go to the dentist, do what we need to do so that our oral environment is very, very conducive to health. The CEO of this functional medical practice says that pathogenic bacteria can enter the bloodstream and reach other organs in the body, including the heart, the liver, the brain. Oral bacteria could in this way lead to damaged nerve cells in the brain, which may lead to cognitive decline and Alzheimer's. So I want to talk to you about that. You can Google. I don't have anything to show you. I wasn't prepared to do that today. But you can go to Google and you can ask Google or whatever search engine you like what meridian is connected to what tooth. And what they'll do is they will give you a picture of an upper and lower jaw. They will number the teeth, and then they will say, this tooth corresponds with this body system. This tooth corresponds with this body system. Also, believe it or not, in your spine, your vertebrae are connected and are correlated with your teeth. So if your spine is misaligned, you can be having some dental issues. So people don't talk about that because I don't know why they don't talk about it, but they don't talk about it. So I'm talking about it. When you have a tooth pulled, when you have a tooth filled, when you have a root canal, it affects your entire body. And so I kind of want to touch on this just a little bit because people will go to the dentist says you need a root canal, and they'll say, oh, well, it's no big deal. Let's go ahead and do this, right? Not necessarily the right thing. So because this tooth, all these teeth are connected to different systems in my body, if a tooth is pulled and the dentist doesn't deal with the periodontal ligament, right? Disease, bacteria, and that kind of thing can get in that ligament that holds that tooth in and travel down to the organ in the body and cause destruction there. That's why when you do root canals and that kind of thing, the tooth roots are very, very tiny. They only do root canals when the tooth really, there's not much left in the tooth except decay and bacteria and that kind of thing. So when they do a root canal, they drill out everything that they can, and then they pack it with antibiotics, and then they pack it with whatever they pack it with, and then they crown it or whatever so that you can keep the tooth. Well, what happens is that bacteria at the very bottom of the tooth can go through that periodontal ligament and affect other places in the body. And so we want to be real, real careful that we avoid that if possible. If we cannot avoid that, we want to see a biologic dentist so that they can do it with the least amount of harmful toxic chemicals, and they can prevent that bacteria from going down into the rest of your body through those meridians. So that's a lot of information. If you have already had a root canal, don't panic. You can go to a biologic dentist. They can tell you if it's causing you problems. They can tell you if you need remediation and that kind of thing. So don't panic. Sometimes we have to do those things because we don't know any better. And having something done is worse than not having something done. No, not having something done is worse than having something done. And so we want to make sure that when we're working with these things, we make the best choices that we can. And sometimes people don't know that root canals are not the best option, and so they do those anyway. So do not panic if you've done that, but move forward and see if you need to have remediation to prevent you from having any of this heart issue or autoimmune issue and that kind of thing. A well-known European Heart Journal published a study in 2019 on a large population cohort of 270 696,000 healthy adults without a history of major cardiovascular disease with a median age of 52 years. There was a follow-up at about 10 years. In the results of this study, it found that people who brushed their teeth 3 or more times a day had a 19% lower risk of cardiovascular disease compared with people who brush their teeth once a day or not at all. In addition, regular professional dental cleanings once a year or more can reduce cardiovascular risk by 14%. After multivariable adjustment, the study showed that brushing your teeth, right, more than once a day reduced your risk of cardiovascular disease by 9%. So that is significant. Nobody wants to have cardiovascular disease. And if all it takes is brushing your teeth more than once a day, then that's an easy fix. That's just a real easy fix. And so I don't want you to raise your hand if you only brush your teeth once a day, because I don't want to know. But I would like to know how many of us know people who only brush their teeth once a day or not at all. I mean, it's not a topic of conversation. Hey, ladies, how many times a day do you brush your teeth? Right? We don't do that. However, if people have really bad teeth, you might ask them how often do they brush their teeth, and you might encourage them that brushing their teeth at least twice, if not 3 times a day, could go a long way in preventing cardiovascular disease, cancer, and autoimmune issues. Regarding habits to improve oral hygiene, the functional medicine doctor says that an imbalance of oral microbes can be adjusted through functional medicine studies, including nutritional intervention and lifestyle changes. He suggests strengthening oral health in the following ways. Have regular dental checkups and take care of your teeth in the between times, all right? Use toothpaste or powders that contain probiotics. Now, I have never, ever seen a toothpaste or a tooth powder that contain probiotics. We do probiotics. Maybe brushing your teeth with probiotics is an answer. I don't know. I've never done that, but that might be something that we can do. Certainly in the United States, I've never seen that. Maybe in Canada you have that. Maybe in Europe you have that. I don't know. We can see on that. Make flossing a part of your daily ritual. We do that in our household. And so flossing is a good thing. Why? Because it reaches those little inside places between the teeth that the brush doesn't always get. And so you definitely want to do that before you go to bed at night, because you don't want that food decaying in your mouth, causing you to have those nasty bacteria in there that leads to all the other things. And then you want to eat probiotic containing foods, which I think all of us do that. All of us do probiotics, or we should. We may drink kefir, we may eat yogurt, we may eat sauerkraut, we may eat, I'm trying to think of something else that's fermented. Soy sauce is fermented and that kind of thing. So whatever you like doing that has probiotics in it is a good idea, because probiotics keep the bad bacteria low, keep the good bacteria high, and when your good bacteria is where it needs to be, then it squashes all the negative ones. And so, again, when I was reading this article, I was thinking, I don't know anybody that doesn't brush their teeth. Little children, yes. Toddlers, yes. You have to be on them all the time about brushing their teeth. But full-grown adults, it would never occur to me that people just would not brush their teeth. It just would never occur to me. I also had no idea that when you brush your teeth at night, that is the most significant time to brush your teeth. Brushing your teeth at least twice a day, if not 3 or 4 times a day, gives you the best opportunity to avoid cardiovascular disease and autoimmune issues. And so for me, that's a big incentive. Not that I need an incentive to brush my teeth, because I already do that. I'm raising my hand. I already brush my teeth twice, if not more, in a day. And so I think I'm pretty good in that area. Flossing is something that we do as well. And so we're doing the best that we can do. Just by the way, if you take your toothbrush and you put toothpaste on your toothbrush and then you stick your toothbrush under the water, you are retarding the cleansing capacity of the toothpaste. Why is that? Because the toothpaste just by itself is abrasive enough to clean all the stuff off of your teeth. And so when you're putting it under the water, which my mom taught me how to do that, you put the toothpaste on the brush, you stick it on the water, you brush, right? Well, I learned when I was about 50 from a chemist that when you do that, you're not getting the efficacy of the toothpaste, and so it would be better not to do that. So since then, I have not wet my toothbrush before I put it in my mouth to brush my teeth. We also, last year, we changed to a whitening toothpaste that is fluoride free. And I really like that, and we got results in a couple of weeks. I was really, really pleased because going to the dentist and having your teeth whitened, lots of chemicals, lots of abrasion, and so that might not be the best thing for you because, you know, when you do that, and I have done that in the past, you come out and your teeth are all sensitive. That's not a good idea. You want to do things that don't make your teeth sensitive, okay? And so this is a lot of information about your teeth. This is a lot of information about oral hygiene. You also don't necessarily want to do mouthwash, brush your teeth. You don't necessarily want to do mouthwash at the last, before you go to bed because you mess up all the good bacteria. So think about it. Do your own research. See what you need to do moving forward so that you can have the best oral health. If you don't see the dentist every year, you might want to think about that. If you don't floss every day, you might want to think about that. There's a lot of far-reaching health implications of taking care of your teeth. So it is the holiday season, so everybody's eating more, drinking more sugar, more sweets, more of all the things that we're not supposed to do. So hopefully at this time, you're going to have a lot of opportunity to improve your dental health. And when you do that, you're also going to improve your long-term outcomes of avoiding cardiovascular disease, cancer, and autoimmunity. So it is Friday. What we want to do is to do some self-care, try not to get caught up in the hustle and bustle of the season and be stressed. We don't want you to be stressed. We want you to enjoy this time with your family, enjoy this time with all the people that we know and love, and to be good to ourselves. And remember the reason for the season, okay? It's not about the presents. It's not about the presents. So be good to yourself, self-care, and I will see you next week.